Hello, my name is Maria Vincent, and I'm a health sciences student at Drake University and an intern at the Iowa Heart Foundation. Today, I will be presenting on the state of heart health in Iowa. In the United States, every 34 seconds, someone dies from heart disease. In 2020, 1 in every 5 deaths was due to complications from heart disease, which resulted in 697,000 people dying in the United States alone. From 2017 to 2018, heart disease cost the United States $229 billion due to healthcare services, prescriptions, and lost productivity as a result of death. By the year 2035, it is predicted that 45% of the United States population will have at least one form of heart disease. This is an increase that would lead to more cardiovascular deaths. Heart disease is not just the leading cause of death across the nation, it is also the leading cause of death in Iowa. Heart disease has been the leading cause of death in Iowa since 1920, and stroke is the 7th leading cause of death currently. Iowa ranked 20th in the nation for highest rates of cardiovascular death. In 2020, 7,444 Iowans died from heart disease, and 24.6% of all deaths in the state were from heart disease and stroke. Iowans had more than 23,440 hospitalizations and $1.4 billion in costs due to heart disease. Heart disease encompasses many conditions that all result from plaque buildup in arteries. When the plaque builds up against the artery walls, blood flow is restricted and there's more resistance when blood travels. Blood flow can be completely blocked by a blood clot, resulting in a heart attack or stroke. The total cardiovascular disease death rate per 100,000 includes people of age 35 or older, of all races and ethnicities, and all genders. From 2018 to 2020, the nation had a cardiovascular death rate of 319.5 deaths per 100,000. Iowa had a higher cardiovascular death rate during this time at 330.4 deaths per 100,000. Looking at the cardiovascular death rates of each county, 63 counties in Iowa had cardiovascular death rates higher than the national average. Shown on the figure on the left, you can see that the counties that are darker in red had a higher cardiovascular death rate. Many of these counties are along Iowa's southern border. The table on the right compares the 10 counties with the highest death rates to the national average. Looking at the age-standardized cardiovascular death rate per 100,000, there is a decline in the national average while Iowa's rate has been on the rise. Unfortunately, the preliminary data since 2020 has the national rate back on the rise again. If you look specifically at individuals younger than 65, there hasn't been a decrease in the past 10 years. Again, looking at the age-standardized cardiovascular death rates per 100,000, when broken up between biological men and biological women, the men have a significantly higher death rate than the women. The men's cardiovascular death rate in Iowa has passed the rate of men nationally. The women's cardiovascular death rate has begun to trend upwards while the rate of women nationally has continued to decline. The buildup of plaque in arteries that leads to heart attack or stroke are often resulting from lifestyle choices such as poor diet, lack of exercise, and smoking. The prevention of controllable risk factors is important to reverse the epidemic of heart disease. Counties in Iowa with the highest rates of heart disease death have higher levels of risk factors such as high blood pressure, high LDL cholesterol, diabetes, smoking, obesity, unhealthy diet, and physical inactivity. It has been found that cardiovascular disease in Iowa is more common in men when compared to women. Adults over the age of 65, Black non-Hispanic Iowans when compared to other ethnicities and races, adults whose annual income is less than $25,000, and adults who live in rural communities. We know certain populations are at great risk, so we can use that information to target those audiences. The Iowa Heart Foundation is a nonprofit organization focusing on the prevention of heart disease. For over 30 years, the foundation has contributed to clinical and community outreach. The Iowa Heart Foundation is committed to improving heart health for Iowans through the following strategies: community outreach and education, promising prevention programs, and clinical educational support. One of the strategies of the foundation is to encourage Iowans to know their numbers. That includes blood pressure, blood glucose, and cholesterol by visiting their healthcare team. Knowledge of these numbers is essential in the prevention of cardiovascular disease. The Iowa Heart Foundation has launched an awareness campaign providing education on the prevention of heart disease. Here are some ways to get involved. At the national level, Millions Hearts is a national initiative co-led by the CDC and the Centers for Medicine and Medicaid Services. The initiative exists to convene healthcare and public health champions, facilitate impactful collaboration and resource sharing, promote implementation of evidence-based strategies to prevent cardiovascular disease, and address health inequality. To learn more, visit millionhearts.hhs.gov. And here are the references.